Uh, Welcome to today's lecture. Today we'll be discussing hemolytic disorders. Today we'll be discussing hemolytic disorders. We'll be discussing hemolytic disorders. To begin with, we're going to look at thrombocytopenia. Thrombocytopenia is what we're going to discuss in medicine today. Thrombocytopenia. Thrombocytopenia is defined as a lower than normal number of circulating platelets. It's just a condition or disorder where you have low number of platelets in the body. Platelets are the ones which are responsible for blood clotting. So a decrease in the having lower numbers of platelets is what we call thrombocytopenia. The normal platelet level ranges from 150,000 to 400,000. So if it's below 150,000, it's what we call thrombocytopenia. Thrombocytopenia is, is present when there is significant decrease in the number of thrombocytes in the body. When there's decrease in the number of thrombocytes in blood, it's what we call thrombocytopenia. They are destroyed as soon as they are produced or because they are not being produced. So it can either be they are destroyed as soon as they are produced or they are not being produced. So today we're discussing thrombocytopenia, which we said is just a disorder or condition where you have less than normal number of circulating platelets. So the normal range should be 150,000 to 400,000. So if they are below 150,000, it's what we call thrombocytopenia. So disorders due to defect in the blood vessels. So that this type of disorders can be caused by a wide range of infections. So if you have too much infection, it can lead to defects. Uh, Infections such as measles, typhoid, fever, septicemia. They can also affect the number of platelets. Chemical agents may be also be responsible, damaging vessels such as aspirin, furosemide, indomethacin, snake poisoning. Anaphylactic reaction can also play a role. Conditions such as hepatitis and renal failure can also play a role. The normal lifespan is approximate 8 to 10 days. In thrombocytopenia, it's just 1 to 3 days. So there are various conditions which affect or which contribute to the reduction of white blood cells are the ones we are from discussing, such as a wide range of infections, such as measles. If somebody has measles, it can be fever, typhoid, septicemia, infection of the blood. They also play a role in reducing the number of platelets. Also, chemical agents that may also be responsible for destroying blood vessels, damaging blood vessels, such as aspirin, furosemide, indomethacin, also snake venom can also reduce the number of platelets, and also anaphylactic reaction can also reduce the number of platelets. Conditions such as hepatitis and renal failure, they can also contribute in the reduction of platelets. And as from what we discussed, we said the normal range lifespan for platelets is about 8 to 10 days. In thrombocytopenia, it's usually 1 to 3 days. Causes thrombocytopenia is decrease in platelet production. A, first it can be inherited. Second can be acquired. So it can be as a result of inheritance or acquired. If it's acquired, the common one is aplastic anemia, and also hematological malignant disorders can also be the contributing factors, and also myosuppressive drugs, chronic alcoholism, exposure to ionizing radiation can also play a role. Viral infection, as we mentioned from the other side, that we are measles, typhoid fever measles can also play a role. Deficiency of folic acid can also play a role. The other is immunity. Immunity, we are looking at immune thrombocytopenia papillae and also immunodeficiency virus infection. And also others is drug induced. So under immunity, we are looking at immunity, thrombocytopenia, papillae, and also human deficiency virus infection, and also drug induced, as we mentioned that certain drugs such as aspirin and also indomethacin play a role. Also, um, splenomegaly. Splenomegaly also play a role. Also, drugs, spices, vitamins causing abnormality in the platelet functions, like suppression of platelet production. Certain drugs, like we mentioned, aspirin or acetylsalic acid, indomethacin, uh, they also play a role. Sulfide, diuretics, as we mentioned, furosemide also can play a role. Alcohol, chemotherapy drugs suppress the production of uh, cells in the body, in the bone marrow. So they also play a role in reduction of platelets. So we're still looking at thrombocytopenia. So those are some of the contributing factors to thrombocytopenia. Also abnormal platelet aggregations such as NSAID, brufen, indomethacin. They also play penicillin, cephalosporins, analgesics, talked about aspirin, and also spices, ginger, quinine, garlic, vitamin C and E also play a role. Heparin and other medications such as chloroquine, methidopa, oral hypoglycemic agents, quinine, rifampicin, they also play a role in in the abnormal aggregation of platelets. So we're going to look at prothrombin deficiency. Prothrombin deficiency, we're just talking about deficiency of vitamin K, vitamin K deficiency. So vitamin K deficiency is essentially production of prothrombin by the liver. So vitamin K is essential for the production of uh, prothrombin by the liver. So meaning that vitamin K plays a role in the production of prothrombin by the liver. Deficiency is due to the following. So there are certain deficiencies can lead to vitamin K, such as inadequate intake of vitamin K, impaired absorption of vitamin K. If you eat vitamin K food content but it's not absorbed in the abdomen, it also affects to bring about deficiency of vitamin K. Defective utilization of vitamin K. Defective utilization of vitamin K also can cause prothrombin deficiency. Bowel salts are also essential in the intestine for absorption of vitamin K. So bowel salts are also essential in the absorption of vitamin K. As we mentioned that impaired absorption also plays. So bowel is essential in the absorption of vitamin K. So a common cause of prothrombin is obstruction of flow of bowel into the intestine. So if bowel is obstructed from flowing into the intestine, it leads to reduction in the absorption of prothrombin, leads to reduction of absorption of prothrombin. Treatment when somebody has vitamin K deficiency, or you usually treatment you give vitamin K supplements, you can give vitamin K supplements, you can do blood transfusion, maybe if indicated, especially if in liver disease, you can do blood transfusion. You can also do a complete bed rest. You can also protect from injuries, make sure that you protect the patient from injuries because the clotting factors is affected. So a patient can have a prolonged breathing without these platelets that are very essential. Some of the nursing care for the patient of hemorrhagic disorders. Our objective in nursing care of the patient with hemorrhagic disorder is to prompt identify bleeding and also prevent blood loss, identifying bleeding and prevent blood loss, control bleeding when it occurs, and also prevent further complications. So the things we look out for is to identify bleeding and also prevent blood loss, control bleeding when it occurs, prevent complications. So position, if joint pain is present, support the area of the pillow, joint immobilization, and local chills may bring relief. If pain is severe, it may be necessary to aspirate blood from the joint. The nurse can control topic breathing quickly by applying pressure or ice to the injured site, packing the area with fibrin foam, and applying topical hemostatic agents such as thrombin. Press the body in good body alignment. Need for bed cradle because of painful joints. So you can use also a bed cradle for painful joints. Psychological explain the nature, the cause, the signs and symptoms of disorder to the patient and relatives so that they can also allay anxiety and also they can be informed about the condition, inform the patient about all the procedures they're doing to the patient to gain cooperation, also inform the patient about the safety activities that they should do to avoid causing injuries, explain procedures taken when doing activities to minimize injuries. So you can explain why you're doing certain things to minimize injuries. Also emphasize the need factor for replacement of vitamin K. So explain why you're giving the patient vitamin K so that they understand that it is important for the body. Emphasize on the ablat action to be taken when breathing occurs. Also, if a patient is in school going age, teachers should be informed of the individual's condition, if the necessary restriction and precaution, and action to be taken if the patient sustained injury or start breathing. So the schools, if a child is also going to school, the teacher should know about the condition and also they can know how to minimize the breathing. Observation, check vital signs, CPR and blood pressure to check any deviation from normal. Should be checked less frequent and change the site to avoid unnecessary pressure on the arms. Site of cerebral dysfunction, sign of cerebral dysfunction, including confusion, disorientation, restlessness due to breathing in the brain. All those people, you should observe for that as a nurse. If you see any confusion, you see confused orientation, it can be a sign of cerebral dysfunction. Sign of internal breathing such as pallor, weaknesses, air hunger, tachycardia, low blood pressure, those are signs of internal breathing. So you should also observe for that. Open lesions, incisions, IV, and intramuscular site of breathing or hematoma, you should also observe that to arrest breathing. Examine and test the excreta using urine, excreta including urine, stool, vomitus for blood. Also examine the joints for edema, limitation, limitation of movements and tenderness. Inspect the skin and the mouth for appearance of any patches. Under that, take out with fluids and use a stool softener if necessary to prevent infection and injury to the anal mucus. Encourage light and well-balanced diet. Avoid rough and highly seasoned food to prevent damage to the oral and pharyngeal mucus. Hygiene, daily bath or big bath or shower depending on the condition of the patient. Do dental hygiene is important to avoid tooth extraction. Also, a very soft tooth brush is there is a recommendation for the patient to avoid to prevent trauma and bleeding of the gums. Keep the patient's nails clean and soft. Handle patient gently. The patient confined to bed due to pressure sores or do a 2-hour retaining to avoid pressure sores. So those are some of the measures you can know under hygiene. Drugs, medications you can give anti-inflammatory drugs such as progesterone 20 to 40, BD, OD, and also you can give vitamin K 10 milligrams start because you can give vitamin K. You can also give ferrous sulfate 200 milligrams CDS. You can give folic acid 5 milligrams OD. If any infection, you can give ampicillin. You can also you can give cyclin such as e.g. aspirin are contraindicated. So drugs such as aspirin in this condition they are contraindicated because they they prolong bleeding. So they are contraindicated in this condition, aspirin. or acetylsteric acid. Anything with steric acid, they are uh, not allowed in this condition. Exercise should be mild to non-traumatic. Deep breathing and coughing should be done if the patient is confirmed. Limb exercise are essential in this condition. Limb exercise are essential in this condition. If affected, limb exercise are essential in this condition. Also, any breathing, once breathing stops, swelling subsides, the client should perform active range of motion exercise without weight bearing to prevent complications such as deformity and muscle atrophy. So make sure that you do mild passive exercise on the patient, and also elevate some limbs. Just you can also involve the physiotherapy in doing exercise. They are good at exercises. Elimination, ensure the patient is opening bowel and emptying the urine bladder. They code the amount and color. If patients vomiters, they code the amount and color. Self-education to allow always carry identification band and the type of blood to seek prompt treatment following trauma and area symptoms. Avoid forced sneezing and coughing to maintain adequate fluid. Need to prevent injuries. Make sure that you prevent injuries in this condition. Avoid sports and operations that are present. Also provide information on the availability of the community nurse, the public health nurse. You can give them the availability of them. Need for frequent medical checkups. Importance of taking medication. Avoid wearing tight clothing. Also provide genetic counseling, especially in hemophilia. So those are some of the things we can look at in deficiency of vitamin K. We're going to look at hemophilia. Hemophilia, as you all know, it's a rare condition. Hemophilia is a rare condition, as you all know. Hemophilia is just a coagulation condition that occurs as a result of deficiency of factor 8. Deficiency of factor 8. Factor 8 is anti-hemophilic factor, or factor 9, a Christmas factor. Christmas factor. It's just an hereditary blood disorder characterized by very prolonged coagulation time. So hemophilia is a condition where somebody the clotting time is prolonged. The coagulation time, we're talking about the breathing. When somebody starts breathing, that period for blood clotting in hemophilia, it is prolonged. It's not as normal as everyone. It is prolonged. It has a prolonged coagulation time. Transmission, how hemophilia comes about is it's an inherited disorder. It runs in families. Female, we know that the female has XX chromosomes and the male has an XY chromosome. So that's how it comes about. It's a genetic disorder, in short. It runs in families. It can be transmitted if a male is a carrier and the female is a carrier. There's a chance that a baby can end up having hemophilia. Clinical features: excessive bleeding with slight injury of after tooth extraction. Even brushing of the teeth with a hard toothbrush, there's bleeding. The characteristic of bleeding is persistence rather than the amount. Bleeding into the joints, especially the knees, elbow, ankles, the bleeding in the joints, especially the pain in the affected joints, defect in the affected joints. Those are some of the clinical features. There's also hematuria and also blood in urine. That's what we call hematuria. There's also abdominal trauma. There's intracranial bleeding, which is leading cause of hemorrhagic death. There's delay hemorrhage that follows minor injuries. So when somebody has a minor injury, there's usually delayed breathing, there's delayed clotting time. The common severe symptom, severe, sometimes fatal, especially the bleeding of the nose, one of the signs. So when after injury to the nose, others just breathe even at night. When they sleep, they'll start breathing, or breathing just starts in and out in the nose. Those are people who have hemophilia. Uh, of gastric hemorrhage, those of gastric hemorrhage, this may be linked to gastric disorders such as ulcers and also gastritis. Investigations which are done to rule out hemophilia, we have prolonged bleeding time, also prolonged clotting time, also platelet count if it's normal. So those are some of the investigations which are done in this condition. Treatment, if factor 11 is low, factor 9 is low, it's replaced by factor 8 or factor 9 by infusion. So if any of those factor 8 and factor 9 are low, you replace them. Vasopressin may be administered if it causes constriction of smooth muscles. So you can also give vasopressin just to constrict the muscles. During an episode of bleeding, a patient should be on complete bed rest, immobilize the joints if there is bleeding in the joints, prolong positioning of the limbs in good alignment to reduce probability of deformity. Complications of this condition is antibodies to the artificial factor concentration. So there's usually ankylosing stiff joints, also abdominal mobility and fixation of the joints. So the joints can become immobile and fixation due to pathological changes in the joints and surrounding tissue. So those are some of the complications. So today we are going to end here in medicine. We'll continue next time. For any questions, you can contact me.